Cleaning patient rooms is an important responsibility. People who come into the hospital need a clean and comfortable room during their stay. And after they leave, it's vital that the room be thoroughly cleaned and made ready for the next patient. By learning and following the procedures in this program, you'll be doing your part as a member of the We Serve team.
The procedure for daily cleaning of patient rooms mainly involves the basic 7-step cleaning process you have already learned, but with some special points.
The first point is to be sure you have your cleaning cart set up correctly. Here's a quick review of where all products and equipment should be kept on the cart.
First, we'll look at carts for cleaning rooms with hard floors. On the top shelf, you should have a service caddy which contains your bowl mop, in its container with a solution of SaniMaster 3, spray bottles of SaniMaster 3 RTU, Glass Clean, and Wall Glide RTU, your scrub and shine, bowl care, and a scraper blade. The second shelf carries plastic liners and cleaning cloths. The third shelf has supplies of paper towels, toilet tissue, and soap for soap dispensers.
The bottom shelf is for clean heads for your damp mop, wet mop, and high duster. This is also where you keep a bag for your soiled rags and used wet mop heads, and another bag for soiled dust mop heads. Your can of Solve Oil and spray bottles of Fiber Fresh Ultra Pro RTU and Tile Foam Plus RTU also go on the bottom shelf.
On the front shelf of the cart, you should have your stainless steel bucket with its wringer, your wet mop, a treated 12-inch floor duster, a treated high duster, and wet floor signs.
Finally, several items are hung on the side of the cart. The SaniRinse dispenser, your counter brush, dustpan, product safety guide, and housekeeping schedule.
To set up a cart for cleaning carpeted rooms, there are a few minor changes. The top shelf again should have a service caddy with all the same products, but should also contain the spray bottle of Fiber Fresh Ultra Pro RTU, since you'll be using it more often. The second shelf has the same cleaning cloths and plastic liners, and the third shelf is also the same with supplies of paper towels, toilet tissue, and soap for dispensers.
On the bottom shelf, you will only need your clean damp mop and high duster heads, a bag for soiled rags and wet mop heads, your Solve Oil, and Tile Foam Plus RTU.
On the front shelf, you have a bucket, wringer, and damp mop with a solution of Fiber Fresh Ultra Pro for mopping carpets. You'll also have a floor duster, high duster, and wet floor signs.
On the side of the cart, you should hang your counter brush, dustpan, product safety guide, and housekeeping schedule. In addition, next to the cart, you'll also need to have your vacuum cleaner and a second bucket, wringer, and wet mop with a solution of SaniMaster 3 for mopping the restroom floor.
Before we look at the cleaning process itself, a few general ideas need to be covered. Before entering any patient room, you should always knock. Identify yourself by saying housekeeping and explain that you are there to clean the room.
You should always be smiling and pleasant, but you shouldn't carry on conversations with the patients other than to greet them. Don't ever discuss personal problems. However, if a patient has a special concern or complaint, let them know that you will tell your supervisor about it. Then be sure you follow through and talk to your supervisor as soon as possible.
Never high dust over a patient's head. This can be both unpleasant and dangerous. Do not disturb a patient's personal items that are on nightstands, over bed trays, ledges, or other surfaces.
Most healthcare facilities follow universal precautions for infection control. At a minimum, you should always wear rubber gloves when cleaning a patient room. There may be stricter requirements at your facility or in certain areas of it. Make sure you know and carefully follow all such requirements. If you're unsure about what you should do, ask your supervisor.
Now let's look at the procedures for daily cleaning of patient rooms. The first step is high dusting. You should start by high dusting the area just outside of the door to the patient room. This includes call lights, signs, and picture frames, if there are any.
Inside the room, as always, you should high dust, moving counterclockwise around the room. Make sure you get the tops of picture frames, vents, lights, wall-mounted televisions, doors, hinges, and the edges and corners of ceilings. You should also high dust the restrooms using the same techniques. When you've finished, clean the head of your high duster into the trash container on your cart and return the equipment to its proper place.
Step 2 is spot cleaning and sanitizing. Start by putting your service caddy just inside the door to the restroom. Spray a cleaning cloth with SaniMaster 3 and use it to sanitize all the appropriate horizontal surfaces. You should only do the patient room for now. You'll do the restroom separately. Clean all ledges and furniture and any other surface the patient may touch. Make sure to sanitize the telephone, paying special attention to the mouthpiece and earpiece.
Next, spray a cloth with Wall Glide Plus. Working counterclockwise around the room, spot clean all smudges, splashes, and other spots you find on the walls. Finally, using a cloth you've sprayed with Glass Clean, spot clean all mirrors and windows in the patient room.
Now it's time to clean the restroom. Start with the mirror. Splash some water onto it and wipe it dry with a paper towel. If any spots are left, use a cloth moistened with Glass Clean to remove them.
To clean the sink, spray some SaniMaster 3 onto a cloth. Wipe the inside and outside of the sink, the faucet, handles, and also the pipes underneath. If the sink doesn't come clean, you'll need to use Scrub and Shine on it. Use the cloth with the SaniMaster to sanitize all wall fixtures, including soap and paper towel holders, handrails, toilet tissue holder, and the top of the mirror.
Once you have sanitized the fixtures, you should polish them. Use a cloth you've moistened with Glass Clean to do this.
Next, you should clean the toilet bowl. You'll need your bowl mop and container of SaniMaster. Start by flushing the toilet so that there is fresh water in the bowl. After it stopped running, wipe the toilet bowl's inner rim with the bowl mop. Then wipe down the rest of the inside of the bowl. If there are any urine cups or other items in the toilet, clean around them and don't disturb them. If the bowl won't come clean, repeat the same steps using bowl care and the bowl mop. Now take a cloth moistened with SaniMaster 3 and clean the outside of the toilet. Start at the top and work downward, cleaning the seat, rim, bowl, and base.
Next, you should spot clean the walls in the restroom. Use a cleaning cloth moistened with Wall Glide Plus. Pay special attention to corners and areas around light switches. If there is a shower stall, spot clean the walls inside it. Shower walls may need additional cleaning. Do this using Tile Foam Plus in a spray bottle with a foaming spray tip.
After you've returned your equipment to your cart, the last step in the restroom is to replace any supplies of soap or paper products which are running low.
Now it's time to empty the waste baskets. When you start, you should have with you a cloth moistened with SaniMaster 3. Begin in the restroom and then work in a circular pattern around the patient's room. Grasp the top of the liner in the wastebasket and tie a knot in it. Then remove the liner from the wastebasket. Check the basket to see if it has been soiled. If it has, use your cloth with the SaniMaster to clean off soil or smudges. Replace the liner using the knot and tuck technique.
In healthcare facilities, it's very important to be aware of safety when emptying wastebaskets. Watch for needles that may have accidentally been put in the trash container. A needle could puncture the liner and scratch or stick you. If you're working in an isolation area, be sure to follow your facility's procedures for trash removal and disposal. If you're not sure what those are, ask your supervisor.
Floor dusting is the next step in cleaning a patient's room. As always, start in the corner of the room opposite the entrance and dust toward the door. Use the S-stroke and never lift the mop head off the floor. Be sure to dust under the beds and move wastebaskets and any movable furniture so that you can cover the entire floor. Remember to return everything to its proper place.
When you finish the patient room, leave the pile of debris by the door and dust mop the restroom. When you finish the restroom, combine that debris into the same pile. Sweep up the pile using the counter brush and dustpan and put it into the trash container on your cart. Then clean off the head of the dust mop and return all equipment to its proper place.
If the patient's room is carpeted, you will need to vacuum it. First, pick up any large objects on the floor which could damage the vacuum. Begin in a far corner of the room and work back toward the door. Again, move any light furniture to make room for the vacuum cleaner, then replace everything to its original position. Change to the crevice tool attachment to vacuum in corners and along the baseboards. As you vacuum, Watch for spots on the carpet. If you see any, go back after you've finished vacuuming and use the 40-second spotting technique to remove them.
The next step is floor sanitizing. If your patient rooms have hard surface floors, you may have a Sani-Rinse dispenser on your cart. Here is the proper method for using it. At the beginning of the day, you should see that the dispenser is filled with 3 gallons of SaniMaster 3 solution. Generally, you'll leave what's left in the tank at the end of the day and simply add to it the next day. But once each week or so, you should drain the dispenser and clean out the inside.
As you start your shift, you should also put another ½ gallon of SaniMaster 3 solution into your mop bucket. Dip your wet mop into the solution, wring it out, and leave it in the wringer. Make sure the discharge tube from the dispenser is in the up position. Now you're ready to do the first patient's room. You don't need to rinse the mop again until after you sanitize the floor in the first room you clean. Then simply dip the mop into the bucket and wring it out. Leave it in the wringer as you move on to the next room.
Now, each time you start to clean another room, put the discharge tube into the down position. This puts a fresh amount of cleaning solution onto the mop head. When it's time to sanitize the floor, simply put the discharge tube back to the up position. Wring out the mop head and do the sanitizing. You should follow this same procedure for each room you clean.
If you do not have a Sani-Rinse dispenser, you simply use a normal solution of SaniMaster 3 in your bucket and change it after every 4 rooms. Each time you start to sanitize a floor, you dip your mop head into the cleaning solution in your bucket, then wring out the head, leaving it slightly damp.
Wet mopping a patient room floor is the same as in other rooms. Start at the far side of the room and work back toward the door. Make sure the mop cleans the baseboards and corners. Use the S stroke to cover the entire floor, moving and replacing light furniture as necessary. Flip the mop head halfway through the room. When you get to the door to the restroom, go inside and sanitize the floor there. Then back out of the restroom and finish the rest of the patient room. When you're done, rinse and wring the mop head and leave it in the wringer.
Put a wet floor sign at the entrance to the patient's room. Leave it there until you've finished the next patient's room, and then move it to the new location.
For sanitizing carpeted floors, use a solution of FiberFresh Ultra Pro and MBI. Check with your supervisor for the proper mixture. You'll also have a separate bucket with a solution of SaniMaster 3 in it.
The technique for damp mopping a carpeted patient's room is the same as for rooms with hard surface floors, except that you don't do the restroom. Finish the entire patient's room first. Then use the other bucket with the SaniMaster and a separate mop head to sanitize the restroom. Return the equipment to the cart and put a wet floor sign by the door to the patient's room.
After you finish cleaning a patient room, remember that the final step is just as important as all the rest. Do a careful inspection of your work. Be systematic in looking throughout the entire room. Check it in the same way you cleaned it, from the top down. If you notice that something isn't right, go back and correct it. Once you're satisfied, move on to the next room.
After a patient has checked out of a room, there are some special procedures used to clean the room and get it ready for the next patient. In general, you will perform all the steps involved in normal daily cleaning of a patient's room, but with a few differences. So you will need all the products and equipment which you normally keep on your cleaning cart. And you will also need clean bed linens with you.
Start by removing all linens from the room. This includes pillowcases, sheets, blankets, towels, washcloths, and patient gowns. All linen should be gathered and placed in the linen hamper, which is usually located nearby. Never put loose linens into a laundry chute. Linens must always be placed in an enclosable, lined bag.
Next, remove all utensils from the room. If these utensils are part of your housekeeping responsibility, you should throw out all disposable items such as bedpans, water containers, and plastic bowls. Reusable utensils should be emptied, rinsed, and taken to the proper location to be picked up and sterilized. Your facility will have specific procedures for handling utensils, so be sure you know and follow them. Ask your supervisor for any special instructions.
If you find any of the patient's belongings, take them to the nursing station immediately and notify a nurse. If something seems particularly valuable, you may want to report it to your supervisor, too.
Whenever you do a checkout cleaning, you will sanitize the bed, mattress, and pillow. Moisten a cleaning cloth with SaniMaster 3 RTU and sanitize the mattress. As you do, look for defects such as rips or cracks. Report anything you find to your supervisor.
When you finish the top of the mattress, lift it up and sanitize the top of the springs or lower deck and bed frame. You can also sanitize the other side of the mattress this way. But if the mattress is reversible, you can flip it over to sanitize the other side. Raise the bed and clean the headboard, footboard, side rails, frame, and wheels. Finally, sanitize the pillow on both sides. Now you should make the bed with clean linens. Do one side at a time to save yourself time and effort. Next is sanitizing. Make sure you thoroughly clean the nightstand, dresser, closets, and overbed tray. All of these should be sanitized both inside and out. Clean the mirror of the overbed tray using a cloth sprayed with Glass Clean Pro. Sanitize all ledges and furniture in the room. Make sure you put all furniture in its proper location.
Next, perform the routine spot cleaning of the walls using Wall Glide Plus on a cloth.
If the room has already received its regular daily cleaning, inspect the restroom carefully to see if it needs a touch-up. If it's not been cleaned yet, do that now. Check the drapes and curtains in the room. If there's any damage or obvious soiling, report it to your supervisor.
Finally, use the standard procedures for emptying wastebaskets, floor dusting or vacuuming, and floor sanitizing.
When you've finished all the steps, take a few extra moments to inspect the room very carefully. Is it ready for another patient? Is the room as clean as you would want it to be if you or a member of your family were a patient here? This is the time to take pride in your work.
If your facility uses tent cards to show that the room has been cleaned, put one on the overbed tray. Then record on the checkout form, which is usually at the nurse's station, that the room is ready to be given to another patient. Knowing and using all the proper methods for keeping your facility clean are important responsibilities for you. But there is another part of your job that is just as important, and that's courtesy.
When you treat other people with courtesy and respect, it shows that you're a professional. It shows that you care about helping people. And helping people is part of what being a member of the We Serve team is all about. Remember, make courtesy a normal part of your job every day. It all starts with some of the basics of common courtesy. Always think about treating other people the way you would like to be treated. Show your pleasant and cheerful side with everyone you meet. Give a smile and a friendly greeting. Even if you're having a tough day, it will be easier if you don't take it out on other people.
In the workplace, pay attention to courtesy for your coworkers, whether it's a service partner or anyone else. Again, think about how you would like them to treat you. If you borrow a piece of equipment from someone else, make sure you return it in good shape. See that it is clean and replace any supplies or products you may have used up.
In any work situation, there are bound to be conflicts or disagreements sometimes. It won't do anyone any good if you get angry and argue. Even if you simply try to ignore the problem, it probably won't go away. In fact, it will probably just get worse later on.
So anytime you have a conflict with a coworker, make sure you talk with your supervisor right away. Be honest about what's bothering you, but try to be as fair as you can, too. Remember, there is always more than one side to any story. Your supervisor may be able to work out a solution to the problem on the spot, or it may take some time to find the answer. Whatever it takes, be as helpful and supportive as you can. It's always in your best interest to cooperate.
In healthcare facilities, you need to be especially courteous to patients and visitors. After all, they're going through a difficult time. And they see you as one of the people whose help they need right now. Show them that you're concerned by treating them the best that you can.
Always knock and announce that you're with housekeeping before entering a patient's room. Greet the people you meet cheerfully. Explain why you are there, being as courteous as you can. Be aware of what's going on in the room and make sure not to interfere. Show respect for the patient's privacy. After all, this room is their home while they're in the facility.
Though a pleasant greeting is nice, don't be overly talkative with the patient. Don't tell them about your problems or ask them about theirs. That's not why you're there. Remember that your main responsibility is to get your work done. Whatever you hear or see in a patient's room, keep it to yourself. Respect the privacy of patients and visitors just as you would want them to respect yours.
If a patient has a complaint, listen carefully. Show them that you're concerned. Never argue with the patient, even if you think they are wrong. Once you understand what the patient's complaint is, let them know you will report it to the appropriate hospital authorities. Then inform your supervisor about it as soon as possible. In some ways, you are the eyes and ears of the housekeeping department, so make the effort to do your part.
Common courtesy is the first step in being a first-rate service partner. It doesn't take much effort, but it goes a long way in showing that you want to be the very best service partner that you can. So make courtesy a routine part of how you do your job. It will make your workday more enjoyable. People will see you as a true professional, and you'll feel good about yourself in the process.